Thank you, Mr. Chair. I just had a question for Representative Jacque. I don't think I've ever asked you this directly, but I wanted to ask you if you are in opposition to the use of the pill as a method of birth control.
Mr. Chairman, that seems to me to be a fairly ridiculous question that's pretty far afield from the bill that's before us. I certainly am putting forward nothing that would stop the broad array of family planning or contraceptive services. That's what we're providing here. We're promoting it at a state level, is these services. And, you know, actually, if you look at the diminished need for Title X, which is certainly a debate that's occurring at the federal level, I would argue for the family planning and contraceptive element of it. You have Obamacare, which has now mandated that insurance, with very little exception, require contraceptive coverage, or that you go through the exchanges, which again require that contraceptive coverage. Through Medicaid, it's a guaranteed benefit up to, I believe, 300 or 360% of the federal poverty level. So I'm not sure what fishing expedition you're on, but I think that this, you know, is clearly legislation that's going to help family planning and the broad array of preventative public health services in Wisconsin.
You have a question specifically on the
I asked the question, Mr. Chair. The bill is, my question is related to the bill. You're going to limit access to family planning services, and I have been told in the past that you are in opposition to even the use of the pill as a method of birth control. And so my question is, Representative Jacque, are you opposed to the use of the pill as a method of birth control?
I think the question has been asked and he addressed it.
No, he didn't answer it, Mr. Chair.
You're talking about wanting to know his personal beliefs on an issue that is not directly addressed in this bill. There's nothing in this bill that limits
You're
birth
being unfair,
control.
Mr. Chair. It's really, this bill, unfortunately, is going to limit access to family planning services. It's going to make it that much harder, especially for low-income women, men, and teens to access family planning services, STD treatments, cancer screenings, pap smears. It's going to make that kind of preventative health care that much harder for folks, just so you can continue on this obsession with defunding Planned Parenthood. Even your supporters here, I saw them at the doorway with proudly holding stickers that say, what do they say, Representative Jacque? Did you see them?
I did not see the sticker.
They say defund
It sounds like a comment rather than a question, Representative.
Your supporters are wearing huge stickers that say defund Planned Parenthood.
I would agree that Planned Parenthood should be defunded, but this bill does not limit access to any of the services that you're talking about.
That's the goal of
And I
this
don't
bill,
know
to
what
defund
other
Planned Parenthood.
rumors or things that you think that you heard. Perhaps you'd like to bring them up to me individually or have a conversation, but you know, this seems like the sort of, you know, I'm just really disappointed in the question, Representative Zamarripa. Extremely disappointed that there would be this kind of personal partisan attack to shift the focus away from a bill that you cannot defend your opposition to try to take on, you know, innuendos or rumors that you've heard. I think it's ridiculous and frankly untrue.